Make an incision over the dorsal aspect of the proximal interphalangeal joint. Prepare the site so that there is direct visualization of the joint. Resect the subchondral bone and cartilage from the head of the proximal phalanx and base of the middle phalanx. Minimize the amount of resection to avoid shortening of the digit. Insert the guide wire central to the long axis of the proximal phalanx. Slide the cannulated drill over the guide wire. Manually drill clockwise until the depth marker line is concealed. Once complete, remove the drill and guide wire from the proximal phalanx. Insert the guide wire central to the long axis of the middle phalanx. Advance through the distal phalanx until the guide wire exits the toe. Ensure enough guide wire is exposed through the base of the middle phalanx to guide the tap. Slide the cannulated tap over the guide wire. Manually advance clockwise until the depth marker line is concealed. Remove the tap by rotating counterclockwise. Load the threaded portion of the implant onto the guide wire within the middle phalanx. Next, advance the manual driver over the guide wire and onto the barbed segment of the implant until it is fully seated into the driver. Advance the threaded segment of the implant clockwise into the middle phalanx until the distal surface of the driver touches bone and the flats of the driver are facing direct dorsal. Ensure all threads are in bone and the smooth center span of the implant remains exposed. Withdraw the guide wire distally until the proximal tip is completely void from the barbed portion of the implant. Manually compress the barbed segment of the implant and insert into the pre-drilled proximal phalanx. Firmly apply axial compression to the joint so that the bone surfaces are fully opposed. Advance the guide wire proximally to further deploy the barbed segment into the proximal phalanx. The guide wire can now be removed or further advanced for MTP joint stabilization.